Hi, this is Esther Ramsahai, and I am sharing my review on the Framingham Case Study Summary Interpretation presentation. The data used was collected at the first examination for each participant, which was 4,434 participants, with a focus on only age, sex, systolic and diastolic blood pressure, use of antihypertensive medication, identifying as a current smoker, body mass index, and whether the participant identified as having diabetes or not. First, we took the total participants' data and found the mean, including standard deviation, for continuous outcome data sets, as well as the number of and percentage of participants who had dichotomous outcome data. Second, we then split the data to view the same data set, but compared the results for women compared to men. We then did a sample regressive analysis for each characteristic, then a multivariable regressive analysis showing a more accurate association between the various independent variables and BMI. Lastly, we focused on likelihood of prevalence of coronary heart disease and its association between a smaller subset of the initial list of characteristics we started out with. Now, as you can see on the slide, I'm showing some of the details of the study. You can see we started with 4,434 participants. Initially, the mean age was 49.93 with a standard deviation of 8.68. If you look at the pie charts at the bottom, we have the sex as men at 44%, women at 56%. Systolic blood pressure was 132.9 with a standard deviation of 22.42. Diastolic blood pressure 83.08 with a standard deviation of 12.05. Use of antihypertensive medication. Again, look at the pie chart. It was 27% that used the medication, which was very low. Identifying as a current smoker. Smokers were 49%, non-smokers 51%. Total cholesterol was 236.98 was the mean, with the standard deviation of 44.65. Body mass index 25.85, standard deviation 4.10, and identified as having diabetes or not. Having diabetes was 3%, non-diabetic was 97%. The risk factors comparison in men and women. We split out the men and women from the total number, and in men we had 1,944 with a majority of the characteristic averages being lower for men, with the exception of being current smokers. Total women participants were 2,490, with most of the characteristic averages being higher except for diastolic blood pressure, body mass index, and the number of currently identified smokers being only 40.4%. Characteristics associated with BMI. If we compare the characteristics associated to BMI, the crude data shows a different picture with the coefficients as compared to the multivariable. However, the p-values suggest male total cholesterol and being a current smoker were statistically significant. In contrast, the multivariable coefficients show much different numbers and no significance according to the p-values, with most characteristics, with the exception of age and diabetes, indicating the only p-values with a statistical significance. interpretation as to why some likely to have prevalent coronary heart disease. For comparing the significance in the risk factors between persons with and without prevalent coronary heart disease, or CHD, t-tests assuming equal variances were used. A majority of the characteristics reviewed were determined to be of no statistical significance, as their p-values were higher than 0.05, with 2 exceptions. Total serum cholesterol and body mass index both displayed p-values of less than 0.05, indicating statistical significance. As a side note, total cholesterol above 230 milligram per deciliter is borderline high, so I find the numbers for both the history of and no history of coronary heart disease alarming. Those were really high numbers to me, and I highly suggest that these people see their personal physician as soon as possible. And for the last slide, interpretation of data collection methods used versus the best practices. The Framingham Heart Study includes clinical laboratory and outcome data. Participants had between 1 to 3 observations representing examinations held approximately 6 years apart. Because this is a cohort drawn from the general population on a relatively common risk factor, the general population will likely have individuals who do and do not have the risk factor of interest. If this was a rare risk factor and outcome, special attention would have been needed to be paid to enrich the cohort to include participants with the risk factor. Also, an appropriate comparison cohort would include participants free of the risk factor, but similar to the exposed cohort in the other characteristics.